Our topic is going to be a really important one, and I think one that a lot of patients want to know more about, but don't always know the right resources. So this is going to be emotional wellness for chronic lymphocytic leukemia patients. And joining us for this topic is Dr. Lauren Harris. Dr. Lauren Harris is a clinical psychologist at the UCSF Helen Diller Family Comprehensive Cancer Center. She specializes in supporting individuals coping with cancer-related challenges, including emotional distress, physical symptoms, and changes in identity and functioning. She also helps patients with decision-making, communication, and finding meaning in their experiences. Dr. Harris earned her PhD in clinical psychology from UCLA, focusing on health psychology, and completed her training at the VA Greater Los Angeles Healthcare System. I've spoken with Dr. Harris a couple of times, and she is such a tremendously kind person. So we are so happy to have you here with us today.
Thank you, Dalton. Thank you for having me.
Absolutely. And you should be free to share your screen now.
Okay, perfect. Okay, is that coming up okay?
Yep, it looks great.
Okay, great. Well, thank you so much for having me. I'm really happy to be here today. So today I'm going to be talking about emotional wellness for people who have been diagnosed with CLL. And a diagnosis of cancer can understandably bring up a lot of worry and concern about what this means for your life, for your quality of life, the length of your life, how you'll feel, and your ability to do the things that are important to you. And in CLL, patients are often told after diagnosis that they won't need to start treatment right away, and instead they'll be on a watch and wait plan. Well, waiting is hard. And for many people, this can bring up a lot of worry and anxiety as they know something is wrong, but they're not doing anything active to fix or solve the problem. And when something feels uncertain, out of control, and is going on for a long period of time, that's kind of a recipe for anxiety and worry. We as people tend to prefer problems that have an answer, that we can be active in solving, and that we can have a clear plan for. And when we don't have these things, it can be really hard to cope. And so that's why I wanted to focus my talk today specifically on emotional wellness and CLL, on some ways to get support with concerns and challenges that might come up with a CLL diagnosis, and then to give you a few tips on how to manage worry and uncertainty. So here's our agenda for today. We'll start by talking about what psycho-oncology is, what a psycho-oncologist does to support people with cancer and their loved ones. And we'll talk about how to find support, and then get into a few tips for managing worry and uncertainty. And then we'll help you build your own personalized coping toolbox to help you get through challenges. And then at the end today, we'll have time for questions. So first, what is psycho-oncology? So psycho-oncology is a subfield within the field of psychology that studies the ways that cancer affects people outside of just the physical impact of cancer. So some psycho-oncologists are researchers, and some are clinicians that work directly with cancer patients. Psycho-oncologists are specialists in the ways that cancer impacts people emotionally and socially. And they can come from several different disciplines, including psychologists like myself, also psychiatrists, social workers, nurse practitioners, and chaplains who specialize in oncology. And so I'm a psycho-oncologist at UCSF, and I do individual therapy and group therapy with people who are receiving their cancer treatment at UCSF. In my work, I use cognitive behavioral therapy, or CBT, which is really the gold standard therapy for things like depression, anxiety, and stress. And I also use elements of mindfulness and meaning-centered psychotherapy in my work. So the strategies that I'll share with you today are drawn from these evidence-based therapies, evidence-based meaning that there's a lot of research behind them showing that they're effective. So psycho-oncologists provide support to people with cancer and also their loved ones in areas like giving strategies for managing symptoms of anxiety, depression, and distress related to cancer diagnosis and treatment, strategies for managing physical symptoms of cancer, and also treatment side effects, um, helping people navigate really complicated medical systems, advocate for themselves, helping people make difficult treatment-related decisions, helping people to communicate with their medical providers. And we also help people navigate social relationships and some of the ways that your relationships with loved ones might change after a cancer diagnosis, talking with people about what type of disclosure feels most comfortable for them, how to disclose your cancer diagnosis, when and with whom, changes in relationships or roles and responsibilities that people have after cancer diagnosis, and then how to get the most effective support from your social network. And then we also talk with people about finding meaning and purpose in life despite the challenges that you face. So how do you know that you might need help and support in some of these areas? Many people need support shortly after diagnosis, which is often a time of great uncertainty and anxiety. There's a lot of unanswered questions. You're navigating a lot of things at once. Also during any time of change. So if new symptoms are coming up, or if you're planning to start a new treatment, or even finishing a treatment, for example, those times of transitions can cause a lot of distress and worry. But even if you're not in one of those transition periods, but you're finding that you're having a difficult time coping, or you could use support with any of the areas on this slide, you may find that talking with a psycho-oncologist is really helpful, and that even just a few sessions might be really beneficial. So now I wanted to talk about how to find support and some resources for you. So one thing you can do is ask your oncology team if there's a therapist or a social worker at your cancer center. So oftentimes cancer centers will have psychologists or social workers that you can connect with. For example, at UCSF, we have a team of psychologists and psychiatrists who see people who are getting their cancer treatment at UCSF. We also have a large team of social workers. Sometimes social workers provide therapy, or even if they don't, they know a ton about other resources that are available to patients, things like practical concerns like transportation to medical appointments, financial resources, lodging if you live far away from your medical center, and also resources for therapy and ways to find support in your local community. You can also ask your insurance company for a list of therapists in your network who specialize in health psychology or cancer. Now, health psychology is a slightly larger umbrella than psycho-oncology, but health psychologists have specialized training in helping people cope with chronic medical concerns, cope with pain, insomnia, and kind of health-related concerns. You can also search online for terms like psycho-oncologist or health psychologist or cancer psychologist, and then add in your city or your state. Now with telehealth, which has really exploded since COVID, there's a lot of options to get therapy virtually over Zoom or online. And that actually opens up a lot more options to you to be able to see a specialist in psycho-oncology, even if there's not one who lives locally in the same area as you, you can see somebody who lives in the same state as you, so you can search statewide. Also, sometimes you can even see somebody who lives in a different state, kind of just depending on licensing rules where the person is licensed, they'll know, if you're able to see them. Even if they live in a different state, they may be accessible to you, which is great. Another great resource is a website called Psychology Today, which is an online directory of therapists. And most therapists who have a private practice will have a listing on Psychology Today. And you can search for specialists based on a bunch of different types of filters, but cancer is one of those filters. So you can filter based on someone who specializes in cancer. You can filter based on someone who accepts your insurance, their location, lots of different things. And then you'll get a list of people who might be a good fit for what you're looking for. It's also good to know that some cancer organizations offer free or low-cost therapy. So you might want to look for cancer organizations in your local community that may be able to provide in-person or maybe online therapy to support you. I also wanted to mention that HealthTree has some great support resources. HealthTree has regional support groups called care teams, which are made up of patients in different regions around the country. And then also 2 online support groups that are really dedicated to CLL patients. One is on Facebook, and then another is on a platform on the HealthTree website called HealthTree Connect. So those are also definitely worth checking out for additional support. Okay. So a cancer diagnosis almost inevitably brings up worry because there is so much uncertainty, so much that feels out of your control. And of course, it feels very high stakes. It's your health. So it makes sense that worry is a common experience in cancer. And especially in CLL, there may be a lot of waiting and uncertainty, perhaps over a long period of time. So that's why I wanted to focus today on offering some tips on managing worry and uncertainty. So why do we worry? What is the purpose of worry? Although worry is often an unpleasant experience, it actually serves an important purpose. So worry is our brain's way of trying to keep us safe from potential danger. We are really good at imagining all the things that can go wrong in the future and imagining the worst case scenario, what us psychologists call catastrophizing. And that is so that we can hopefully take action to prevent bad things from happening. So for example, say you have an exam coming up in school and you're worried about it, right? You may be actually more motivated to study for the exam because you're worried about it. If you weren't worried at all and you thought, oh, everything will probably be fine, you may not study and then you may end up failing the test. So in that example, worry can actually motivate you to do something helpful for yourself to prevent that bad outcome from happening. In kind of a cancer context, you might worry about maybe you're having a new symptom and you're worried about it and you don't know what's going on. And then that worry really reminds you and motivates you to take the step to send a message to your doctor to check in on it, find out what's going on, maybe go into the office, get it checked out, and come up with a plan, right? So worry can actually be really productive. And we don't want to get rid of worry completely. So that's not our goal. Worry can serve us well. However, when we worry too much or when we worry about something that is completely outside of our control and it begins to take up a lot of our time in our day or maybe makes it hard for us to focus on other things or do other things, then it can become a problem. So here are some tools for managing worry. This is kind of a big slide, so I'm going to break it down and talk about each thing individually. The first step for using a tool is to know when you need to use it. So first, you need to notice when you're feeling stressed or worried. So what are your personal signs of stress? Do you notice yourself getting more irritable with people or impatient? Maybe just kind of feeling overwhelmed, finding it hard to concentrate. Maybe you're noticing that you're preoccupied with thoughts just racing through your mind, maybe having a hard time sleeping. You might have physical symptoms of anxiety, like your heart is racing, your breathing is more shallow, your palms are sweaty. So when you're noticing some of these signs, it's kind of a clue. Okay, oh, I'm feeling stressed, I'm feeling anxious. It's time to reach into my toolbox to pull out a tool, right? What can I do in this situation to help myself out a little bit? The next step is then to ask yourself whether you're worried about something that is within your control or outside of your control, because those two things call for different coping strategies. So when a worry is within your control, when there's something that you can take action on, you can kind of think of this as productive worry, kind of like with the exam, right? You're worried about it and it motivates you to take action and start doing things, right? To try to resolve that worry. So for example, you might need to gather information. Maybe you're worried because you don't have all the information you need. And gathering information can be really empowering to you as a patient so that you can make good decisions about your health and feel confident in your treatment plan. When you gather information, you want to make sure that you are getting information from good, reliable sources, including established, trustworthy websites, and most importantly, from your own medical team who knows you and knows your specific case. You may want to avoid spending too much time Googling and researching online. You might want to limit that, as a lot of people find that it can create more anxiety. Sometimes it's hard to know what is really relevant to you and your case. And so many people find that kind of limiting their research to really just high quality sources and talking to their medical team who knows them and their case specifically can be most helpful for empowering them. Second, I always encourage patients to advocate for themselves, ask questions, make a list of questions before each doctor's appointment. There's a lot of things that are outside of your control in this process of a cancer diagnosis, but this is one thing that you can do to be proactive and feel prepared and feel informed. If you find that you're not getting the information that you need or you don't have the information that you need yet, maybe do some brainstorming to find a way to get that information. Do you need to talk to others with CLL to know what questions to ask or what tests you should be getting? Do you maybe need a second opinion? Many people with CLL have a local oncologist and then also will consult with a CLL specialist who can help to guide their treatment plan and can consult with their local oncologist so that you're getting the best kind of up-to-date specialized information and you can have a team that you trust. Having a team that you can really trust, who you can communicate with, can go a long way in easing anxiety. You shouldn't feel like you're totally alone in this. Also making a plan. So after diagnosis, it can be really overwhelming. There can feel like there's a lot to do and a lot to learn. It's almost like learning a brand new language. And so if you're feeling overwhelmed at any point, you can make a plan and break it down into small steps, the smallest possible steps. So write the very next smallest possible step on your list, something that will take you 10 minutes or less. So if you need to, figure out what is the next step in my treatment, well, that's a big thing to put on your list. Maybe the next thing you need to do is send a message to your doctor to set up an appointment. That's something that you can do in 10 minutes or less. Our brains are really only good at doing one thing at a time. So focus on just doing one thing at a time. You may need to prioritize the most important tasks, and you may during this time kind of need to let other things go when there's a lot to do. Also, in terms of having a plan, some people find it helpful to know the plan. What would be the plan if my CLL did progress? So like, what are the symptoms I should look out for? How often will I have blood work? What are the treatment options? How will we decide? Like, these are great questions and conversations to have with your doctor, feeling like you understand what the plan is, even if it's, far, far in the future, can feel very reassuring and comforting. If you are feeling worried about your health and if CLL feels like it's out of your control, you can kind of redirect that energy to focus on the things about your health that you can control. So your doctor will likely recommend just kind of normal, healthy lifestyle habits, things like having a healthy diet, getting exercise, which of course is also good for your mental health, getting good sleep, staying hydrated. These things are more within your control, and so you can focus on these things. It's also, of course, good for your general health. Another thing that's within your control is to follow your doctor's treatment plan, follow up with your checkups and tests on time. And so you can feel good about following the plan and doing everything that you can do. And then lastly, I put on here, ask for help. So you don't have to figure it all out alone. Use the resources that are available to you. Again, finding trustworthy resources for gathering information. If you're feeling overwhelmed, you can ask friends or family for help, and be as specific as possible in how they can help. So for example, if you need a ride to a doctor's appointment, or help finding a therapist, or help finding someone with CLL that you can talk to. I like to say that being specific in your requests for support is really a win-win. So it's a gift to the person who wants to support you, but might not know exactly what you're needing in that moment, right? They want to support you. You're giving them an opportunity by being specific in what you need. And then it's also a gift to yourself because you're maximizing the chances that you'll actually get what you need if you can ask specifically for that help. Okay, so now we're going to talk about when worry is outside of your control, when there's no kind of concrete action that you can do to resolve the worry because you just don't have all the puzzle pieces right now. And sometimes you can find yourself kind of spinning like a hamster running on a wheel, right? It's just kind of spinning around and you don't know what to do with that worry. This is often the harder kind of worry, harder to tackle. So writing or talking about your feelings can help you find a slightly different way to look at things. It helps to get things out rather than trying to hold it all in. You can kind of spell it out for yourself. It can help to validate how you're feeling, name your feelings. You can even schedule 10 or 20 minutes a day for worry time. When you're feeling particularly worried, dedicate some time in your day to worry time, where you write down all the things that you're worried about. This helps you to sort out how you're feeling, maybe identify any things that you can take action on, like add those to your list if there is any productive worry in there that you can take action on, and really just to validate and name your feelings. That way, when you find yourself worrying at other times of the day or at night, say like when you're trying to fall asleep or in the middle of the night, you can say, okay, it's not my job to worry about that right now. I have this dedicated worry time at 1 p.m. or whatever time you decide. That's the time I'm going to sit down and worry. And of course, expressing your thoughts and feelings can happen in therapy, which is a kind of safe, dedicated time and space that you have for taking care of yourself, learning new coping tools. And that's a great way to express how you're feeling and gain some new tools. If you're noticing that the same worried thoughts are coming up again and again, you can write down what I call coping statements, which are kind of pre-prepared responses to those worried thoughts. So maybe something like, it makes sense that I'm worried, but that hasn't actually happened. Here's what I know to be true right now. If something difficult does happen in the future, I trust myself and my medical team to make good decisions and to handle it at that time, right? So you're kind of gently talking back to the worry, that worried thought, to redirect yourself to how you trust yourself, what's happening, what's true right now. Self-soothing are skills like deep breathing, which can really help to quickly calm down your nervous system. You can look up skills like diaphragmatic breathing is a good like quick, easy tool that you can use at any time. Relaxation exercises, grounding exercises, really noticing how you're talking to yourself, like if you're being overly critical or harsh on how yourself or how you're handling things. I'd encourage you to think about that and talk to yourself like you would talk to someone that you love, like a close friend or a family member, someone you really care about. What would you tell them? You can do things to help you feel more like yourself, which can be really important, and really focus on the present. What's happening right now? What's right in front of me? When you notice that you're kind of on the hamster wheel, when you're worrying a lot, you can gently bring your attention back to what's right in front of you. And you can even kind of gently thank your brain for doing its best to keep you safe, right? That's your brain's job. We're really good at it. And you can say, oh, thank you, brain. I noticed that you're worrying a lot today, but we're going to focus on, what's going on right now. Rather than pushing the worry out of your mind or trying not to have certain thoughts or not allowing it to be there, you're simply continuing with what you're doing in the present moment, focusing on the things in the here and the now that are most important to you. And focusing on doing things that are meaningful and important to you. This is really the best possible use of your time, even and maybe even especially in the face of uncertainty about the future. There may be periods of time when you feel anxious or overwhelmed, like, for example, right after diagnosis, or when you have blood work coming up, or you're waiting for test results. And that's very, very normal. In general, though, CLL is a chronic condition, and you don't want to put your whole life on hold. So learning some of these tools can be really important. On the kind of theme of focusing on the present moment, what I'm talking about is really mindfulness. And so mindfulness is a skill that you can practice over time that has really been shown through research to help with things like managing anxiety and managing depression and managing stress. And so starting a mindfulness practice is a really worthwhile activity. And there are apps like the Calm app or the Headspace app that can help you get started. They have a lot of audio recordings to help you practice your mindfulness. If your worry is feeling overwhelming, I really encourage you to reach out for support through therapy with a psycho-oncologist, which can give you additional tools for managing worry and managing other cancer-related concerns. You can also talk with a psychiatrist who prescribes medications about medication options for managing anxiety, depression, and other mental health concerns. Okay. So I wanted to talk about building a coping toolbox. And I would encourage you to create your own coping toolbox by writing down what are the resources available to you, and what are, like, think of a literal toolbox, right? You have different tools for different problems or different projects that you need. And when you create a coping toolbox, you're writing down a list of things that you can do to help yourself out when you're going through a hard moment. Oftentimes when we're at like a 10 out of 10 anxiety or 10 out of 10 overwhelmed, it's hard to think of, like, what should I do in this moment to help myself out, right? So if you make a list now over time, maybe over the next week, and you file it away somewhere that you can access it easily, maybe it's on your phone, or maybe it's on your calendar or your notebook that you carry around with you. Then you have something on hand for when you're feeling anxious, when you're feeling overwhelmed, or you're just not feeling like yourself. Um, it's like a gift to your future self. Um, so I encourage you to think about what resources are available to you. What are your personal strengths? What has helped you get through hard times in the past? Um, who can you go to for support? And I'd encourage you to think about kind of specifically who is good at what. So some people in your life are good at researching and providing information. Other people may be good at providing emotional support, like it's somebody that you could text whenever you need or call whenever you need, or say, hey, could we go for a walk together? That would be really helpful for me. And then other people are really good at, cooking meals or dropping off something that you might need or watching your kids, kind of the more practical needs. So you can include these people on your list and kind of who is good at what. You can also write down your coping statements, which I talked about earlier. Write those down ahead of time. And those can be helpful in difficult moments for kind of gently reframing your thoughts. So, for example, a coping statement could be something like, this feeling is uncomfortable, but it won't last forever. Or it's normal to feel anxious. I'm doing everything that I need to be doing to take care of myself. Um, or I have a good team of doctors that I trust, and I also trust myself to handle whatever comes up in the future. Think about what actions you can take to help you feel better in the moment when you're having a hard time. This is different for everybody, but you could think of like a list of 5 things, 1 through 5. These are the things I want to try. Even small things, even if it just gives you temporary relief, that's important. So things like going outside for a walk, getting some exercise, calling a friend, watching a funny show or like a funny YouTube video, journaling, like holding a hot cup of tea, right? These are small, accessible things that are in your toolbox, right? You can reach into them and say, okay, I'm having a hard day. What do I need to do to help myself out a little bit? Think about what healthy self-care practices are maybe already in your daily routine, or things that you'd like to work on building into your daily routine. Things like, eating healthy, getting exercise, getting good sleep, and then on a bigger scale, like filling your life with valued and meaningful activities. Like what's most important to you and how do you want to be spending your time? And then, of course, if you need help with building skills, building self-care practices, um, building more tools for coping with worry, then reach out for support. Okay, and with that, I will wrap up my presentation and open it up to any questions that you might have. Thank you.
Thank you, Dr. Harris. That was wonderful. We will get to the Q&A, but I wanted to jump ahead since we're not going to be recording the Q&A session, to give some people, give people that may be watching on YouTube time to hop over into the Zoom if they'd like to. So we'll go through the closing out and then we'll go back to the Q&A and stop the recording at that point. So, um, up on the screen currently, I have the Track My Disease feature of CureHub. Once you've connected your medical records, you can use the Track My Disease feature, which provides you the ability to gain one-of-a-kind access to your health information, encompassing lab results, genetic profiles, and treatment histories, offering you invaluable insights into your own medical journey. I have the link on screen for you to sign up up for the HealthTree Care Hub, along with the email address of our amazing patient navigators who are available to help you create an account and connect your records. We'll also include some information about how to enroll in Care Hub in our follow-up email, so be on the lookout for that. And then I wanted to let everyone know that we're going to have a podcast that I'll be recording in late March. This is going to be going through a deep dive on a new class of CLL therapies that are being developed. These are BTK degraders, so these are different than BTK inhibitors. I'll be recording this podcast late March with Dr. Joanna Rhodes from Rutgers University, and it should be up within about a week or so of finishing that recording. So be on the lookout for that. I'm also planning other webinars. I know that we have several on the book for April, but I'm trying to get some more in March. So if you're part of our mailing list, keep your eyes peeled, because just because it's not on the screen doesn't mean it's not happening yet. And then um, a big thank you again to AbbVie, our sponsor for today's event. We truly wouldn't be able to do these types of events without you. And thank you to everyone who has viewed this presentation. We really do appreciate you and appreciate your support in helping build our HealthTree community. With that, I'm going to go ahead and stop the recording. So we're going to stop the recording and the live stream here so that we can get into the questions. So give me just a moment to get that done. All right, recording is